ErgoSmart from Carpenter Company, the first science-based ergonomic sleep system. Sleep better, the quiet science behind sleep.
Hi, it's Dave Perry. We're back at the bedding conference and we're talking to Dr. Lisa Shives, Dr. Lisa, the Sleep MD. Dr. Lisa is an expert on sleep. Dr. Lisa just gave a great talk at the bedding conference. We thank you for that. And I want to follow up on something you talked about there, which is sleep hygiene. Tell us what sleep hygiene is and how can we improve our sleep hygiene?
It's sort of a funny term. It really just means sleep habits. And so the habits you have surrounding the bedtime into the attempt to sleep and what the environment is like. So the mantra is always keep the room cool, dark, and quiet. But that can mean different things to different people. Some people really need to get blackout shades, whereas other people are fine with some moonlight coming into the window. Basically, if you show up in my sleep clinic, though, it shows that you have a problem. So we try to get it very black. This is where, sleep hygiene is an area of medicine, of sleep medicine that intersects with your mission in the bedding industry. So it needs to be very comfortable, very, very comfortable. And I don't think that sleep doctors often talk about the bed, but maybe I think that we should. We should ask, when was the last time you did get a new mattress? I do think there's a tendency for people to keep a bed for donkey's years, don't you think?
I do. That's a problem.
And I will actually, patients will ask my advice, and I'm very careful, tell them, and I even think that the people I work with at Carpenter Company say, well, there's no one size, for everyone. There's a Goldilocks element to this, right? That you have to find what's just right for you. Mm-hmm. So try different things, make sure maybe there's a return policy.
Okay.
But the other thing that's getting, I think, more attention, it's actually patient-driven, is worries about like allergies and dust mites,
right.
And that actually most doctors just kind of discount. But the patients care about it, so that would be an area that I could see the industry could help educate the public about. It is very, there's dust mites, excuse me, throughout all the bedding and the pillows, and washing it regularly, getting that message across. Again, replacing it more often than you ever would have thought.
Okay.
I think people especially keep pillows for decades.
Right. Donkey's years again.
Exactly.
Now what about this, you talked about laptops. Should we ever take the laptop to bed with us? Yes or no?
Let's just be short with this. No.
Okay. So why not?
Unless you're like in bed with a broken leg, but in everyday life, no. Not only you've broken the sanctum, right? You're bringing the electronics into what should be a spa-like atmosphere of peace, comfort, and kind of shutting out the outside world and the rest of your life. So you brought that in. You're turning your bed into another workplace. This is not good. You're stimulating yourself. Maybe you could be sleeping, but instead you're on the laptop. And there's the fact that the light from the screen is shining in your eyes and stimulating your brain to be in the wake position. And and some people can then close the laptop and go right to sleep.
But some can't.
And other people, again, who are very easily aroused, as we say, once those neurotransmitters get clicked on, they're looking at hours of frustrating struggle to get to sleep.
Okay. Well, hey, thanks for those great sleep tips. Good luck to you. Good luck to Carpenter Company.
Well, thanks for having me.
All right.
It was a lot of fun.
All right. Thank you. This is Dave Perry. We'll talk to you again soon.